for staying with us this far. From politics to business, we now move on to your health. And today we want to have a very informative session on, this is basically a class that we are about to embark on as we get to prepare for the World Antimicrobial Awareness Week, which will be starting on the 18th through to the 24th of November, just creating more awareness about what antimicrobials are, their purposes, and why we need to be careful when it comes to how we use them to avoid misuse and abuse of this category of drugs. Again, we welcome you to be part of this conversation. Our communication platforms ever remain open. The hashtag is Good Morning Kenya on Twitter. Our official station handle is at KBC Channel 1. And do remember to tag me as well. My handle is at Jain Wambui across all the social media platforms. Questions, comments, clarifications, all are welcome in this particular session. And to help us to understand this particular topic better, we have with us in studio Dr. Cynthia Nduta Muregi, who is a clinical pharmacist with a specialty in pediatrics, working at the Kiambu Level 5 Hospital. Good morning, Dr.
Good morning. Good morning, Jane.
Thank you so much for making time to be with us today.
Thank you. Thank you. I'm also so excited to be here to discuss a topic that is very close to my heart.
Love it.
Yeah.
Are you on the socials? Social media ama unachezanga chini kidogo?
Niko chini kidogo.
Uko chini kidogo.
Yes.
Tutaiwacha kwa sasa. So let's just start by understanding, a bit about your background when it comes to clinical pharmacy with a specialty in pediatrics. What does that really encompass?
All right. So clinical pharmacy is first of all, that's two words. That's clinical and pharmacy. So we are looking at the drugs and how they actually now relate to the clinical aspects.
Yes.
How the drugs are acting on the people, how people are responding. Are we causing harm? Are we treating correctly? Are people responding correctly? Are people recovering? Are there improvements that we can make in terms of our drug regimens so that our patients recover better? We enhance patient safety.
Good stuff.
Yes.
Now let us come to this word that we're talking about here, antimicrobials. For some, it might be a foreign word. For some, they're familiar with it, the likes of you. But when we talk about antimicrobials, what are we referring to? What category of medicine or drugs are these?
All right. So when we talk about antimicrobials are drugs, and these are drugs that kill microorganisms or stop their growth.
Okay.
So, and they're usually classified depending on the type of organisms that they're acting upon. So where if it's bacteria, they're acting against bacteria, we call them antibiotics. If antibacterial drugs, if they're acting against fungal organisms, antifungal drugs, and also viruses, then you call them antiviral drugs.
Okay.
Yeah.
Now, in the recent past, and this is also in line with the theme of this year when it comes to antimicrobials, there's this antimicrobial resistance. What does that refer to in line with what you've just been able to describe?
Yeah, so when we talk about antimicrobial resistance, it's a big challenge for us. It's usually when we have organisms that actually kind of change and adapt to a place where they are not responsive to the medications that you are giving. So anytime the bacteria is not responsive to the drugs, then what you have is a disease that you cannot treat, and therefore you have patients, dying, overstaying in hospitals just because you cannot treat them. Whatever the bug that has affected them cannot be treated with the drugs that are available.
Yes.
Yeah.
All right. Now, before I even get to the drivers that contribute to this phenomenon, let's talk a bit about antibiotics. Just looking at the online platform, it's one category that most people are very familiar with, and it also is the category that is most misused and abused by people. Is this something that you can actually say is a matter of fact?
Yeah, very true.
Yes.
It's a big concern where we are having, and especially because I work very closely also with the ICU, many of the patients that actually get to ICU as a result of infections, they come because the bacteria has not responded to the medicines they have been given previously.
Yes.
And so it's a big concern because we also having, when we are culturing organisms in the lab, you have organisms that you can tell this one is not responsive to several organisms that it should be susceptible to. Yeah, so it's a big concern. It's a big concern. And as well, even in Kenya, we are having many hospitals and communities reporting infections that are not responding to antibiotics.
And how has the trajectory been over the years? Is this something that is happening more within the recent past, or it goes way back? Resistance has been something that we've been dealing with for a long time.
Definitely, we've been dealing with resistance for a while.
Yeah.
And so this drive actually for antibiotic stewardship started a long while ago. And especially when scientists discovered that actually we are not coming up with newer molecules. So we have to actually have the old molecules. We have to preserve the older molecules to fight these infections. And so you find that over time, due to the drivers of resistance that you've just mentioned in passing.
Yeah.
Over time, this has been happening. These drivers have been there, and maybe in the past they were not addressed. So already we had a challenge that we are now responding to. Yeah. So that's why we are having activities, advocacy, trainings, just to help people be aware of this challenge and what it will be in the future if we don't address this challenge.
Yeah, and just speaking of addressing it, we even see we had the World Health Organization declare antimicrobial resistance as part of the top 10 threats when it comes to humanity.
Yeah.
How worse would it get should we not be conscious, and especially look at individuals, the kawaida mwananchi, who we can get antibiotics over the counter, who can access some of these antibiotics very easily. If we don't address the problem now that we are here, how much worse would it get within the next 50 years?
Yeah, actually there's WHO was actually saying that by 2050 antimicrobial resistance would cause up to 10 million deaths per year. So, and that's a big concern because you're looking at quite a huge population actually succumbing to just infections that would have been treatable, but because of the resistance, then now we cannot treat them. Yeah. And
that boils down to individual responsibility, not just leaving it to the medics who are, at the forefront, of course, but at the end of the day, the population surpasses the number of professionals that we have. Now, remember, this is all about the Antimicrobial Awareness Week, which will be coming up in the next week. And please, mukisikia nimeshema hiyo antimicrobial, please do not come after me. My tongue, it can betray us at some point. But nonetheless, we welcome your questions, your comments. If you're just seeking clarifications, this is the platform for you to be able to do so. We have been speaking with Dr. Cynthia Nduta, but now we are also joined by another beautiful lady with us on set to just contribute to this whole conversation. She is Karen Bett. She is the Policy Manager at Global Partnership for Sustainable Development Data. Good morning, Karen.
Good morning. It's nice
Thank you for making time.
Thank you.
All right. Before we get back to where we were with Dr. Cynthia, let's just get a bit background on your organization in line with this conversation when you talk about antimicrobial awareness.
Yeah, thanks for having me. As mentioned, I work with an organization called the Global Partnership for Sustainable Development Data. Yeah. So as the name ends, it's about data, and we really champion the use of data and access to data.
Yes.
How we found ourselves in a conversation on AMR, we were funded by the Wellcome Trust to have to generate data around antimicrobial resistance from sources that we hardly hear of or that we hardly use. As Dr. Nduta mentioned, if you want to know or understand about antimicrobial resistance, you'll go to a hospital. But you forget that the decisions around using drugs, misusing drugs, are done by people in their homes. So really our study was to understand what are some of the things that drive people to misuse antibiotics, to overuse antibiotics, not to seek health care, and what are some of the things that limit them from going to a hospital to get a prescription, because that's the requirement of antimicrobial resistance and misuse and using of antibiotics, that you need to have a prescription. But often, and you'll agree with me, many of us buy antibiotics over the counter. We don't finish our dose. We share our drugs with our neighbors, with the children of our sisters and brothers. So we have a lot of activities that are really driving antimicrobial resistance, and this is even before you find yourself in a health facility where it has gotten worse. So really the data was, we were collecting data with citizens, engaging citizens on antimicrobial resistance to understand how much do they know and what are the drivers. And we used interactive radio. So over 10 weeks, and Dr. Cynthia was one of our radio guests.
Yes.
We're just having a really candid conversation about antimicrobial resistance with citizens in their own language. So we're doing radio shows in Kikuyu, in Abaluya, and also in Kiswahili over 10 weeks, and then gathering, and having people respond via text, and we analyzed all that data and came up with, key recommendations or key highlights around people's, drivers or what makes them misuse antibiotics.
Absolutely. And, just on that particular point of the drivers, from my research, I did see that antibiotics are one of the most abused category of drugs. And we want to come to those drivers that actually enable this particular practice to continue thriving. And as you mentioned, Doctor, there needs to be a prescription in order to get this medicine. But that in itself is the driver for misuse and abuse of antibiotics. We have poor prescribing practices in our country, and it is a two-way street. Both the common mwananchi is misusing prescriptions, and the doctors on the other hand might not be as diligent, or there are loopholes here and there. What do you make of all this when it comes to poor prescribing practices in line with a driver for, the misuse and abuse of antibiotics?
Yeah, so when it comes to prescribing, it's, as you're saying, it's a two-way.
Yeah.
So you as the patient, when you're sick, where do you go to seek for help? And if you go and say, I want this antibiotic, I don't want anything else. So already you have created the barrier to being helped and to being given the correct medicine. And again, where do you go to seek that antibiotic? And that's why we advocate for go to the right places, go to the hospitals where you can get a good prescription and have the right dose, the right duration of time, where you can also ask questions and say, this drug, so what do I expect? How long should I take it? Have a conversation with the healthcare provider. And then now when you go to purchase the drug, also get some information from there. So, but then now if we go and insist, this is what we want, and as well now I come to my fellow practitioners where we just want to sell and make money, I think we know that that's wrong, and we are becoming part of the challenge instead of being part of the solution.
Yes.
So I want to call on you all out there who are selling these drugs. Let's be careful. Let's sell on prescription basis. Let's know who we are giving these antibiotics so that we can minimize this resistance issue that you are having.
All right. Yeah. And I'd also like to get your thoughts on this, Karen. From the research that you did and all the data that you gathered, when it comes to prescription, the issuance of prescriptions, how much did it contribute to it being a factor that drove or enabled misuse and abuse?
Yeah, it was one of the main drivers, to be honest, and I think it was like the major one, because we find that people take prescriptions or take antibiotics even when it's not necessary. So when you wake up, yes, kahoma kanakuja, nasikia joto, antibiotic. That may not be necessary unless it's determined that you actually have an infection. Or sometimes people delay. So you have an infection, but you keep saying, I'll get better. I'll take traditional medicine.
Herd immunity.
Yes. So those are some of the drivers that you end up going too soon, or going when you don't need to, or taking too long to get a prescription.
Yes.
The other one is, as Dr. Cynthia mentioned, you're prescribing to the doctor what you want. So you're actually becoming the doctor that you're telling the doctor. Yes, Nyandikie is Zithromax. Only Zithromax and nothing else.
Amoxicillin.
Yes, or amoxicillin. we're all culprits of this, and these are practices which really create resistance. Makes the bugs harder to fight, but also in terms of regulation. I think the other one which came up is that regulation that I've finished with, that there's there's a feeling that the health practitioners or the regulation of the chemists, we're not enforcing. We have the regulations in place, but enforcing them is another challenge.
Okay, I think we'll be coming to that in a bit, but just before we get to that, let's take a step back and understand this misuse and abuse of drugs from a medical standing, because we might not really understand when we talk about this, because for most people, I think misuse means using it when you're not supposed to use. But abuse of this particular drugs, if you have been prescribed for this particular drugs 3 times a day for 5 days, and they threw unasikia niko sawa, so you know, I don't need any that. Is that part of the abuse of drugs or misuse?
Yeah.
How would you, medically speaking, professionally speaking, define these two terms when it comes to the abuse and the misuse?
Yeah, so that's a huge spectrum.
Yeah.
Because you're talking of from the prescriber.
Yes.
If the prescriber probably has not prescribed in a way that is correct for the patient, and that's the lower part of it. But then the other part now is now to the patient. So when it comes to the patient, number one, have you understood? Have you listened correctly to what the doctor has said? Have you gotten the actual dose that you should take?
Yes.
So if you take wrongly, and again, as you're saying, you're supposed to take for the correct duration of time. So if you take the drug and you feel better and then you stop taking, you still have that bug not being completely eradicated. So then that's how we start developing resistance. The other thing is storage. How are we storing these antibiotics? There are some antibiotics which we need to refrigerate. So if you don't refrigerate, which means you're taking something which is substandard. So I'm saying the spectrum is quite wide. Yeah, and also now if you're sharing, then if you had some remainder of antibiotics and you're saying, I think this drug helped me last time, so I think I still have 3 more tablets somewhere. I can take. You see now that's quite a wide spectrum. And also discarding, how we discard these antibiotics as well contributes to the misuse and the abuse.
And I am guilty of being in that category. Unakunywanga dawa siku 3 siku 4 unasikia uko sawa, you're like what's hizi nieke in case karudi tena. We have our own community pharmacy in the house for backup in case of this. Niko na dawa hiyo. Unasikia throat aje kuja. Guilty of that, you know. And I think this is something that most of us have done at some point. But that now brings me to the other side of this particular line, for that matter, and that is now the practitioners or the chemist or the pharmacist who is issuing out these drugs over the counter. I mean, they're meant to be over the counter to enable access, but now when it comes to the regulations that govern them in line with issuing these drugs, tell us a bit about that, Karen.
Yeah, so what came up in the study was really that we have the legal requirements, but enforcing is a real challenge. And particularly, we had this in Kilifi County, for example, that you can actually get antibiotics in an open market, so like in the Soko, so which was really surprising. But it just shows how weak we are as a country when it comes to enforcing these regulations. And I think this is a really major driver of access to antibiotics, which drives misuse.
The same thoughts on that when it comes to how easily, or rather the loopholes that are there when it comes to the issuance of these drugs from the chemist or the pharmacist to the individual who is purchasing them, regardless of the fact that they may not have a prescription.
Yeah, so that's becomes a big concern, because now if the patients have easy access to the medications, then it's a challenge. So PPB is what we depend on to make sure that each person who is administering or stocking or selling these antibiotics is somebody who is registered, is somebody who is qualified. Yeah, but again, on the other hand, this is a personal initiative where you as a pharmacy or chemist owner, you're able to say that, no, I do not sell these drugs without prescriptions. And so that again points to us empowering even our healthcare workers, our retailers, and just making sure that they're actually practicing this.
All right.
Yeah.
Now that brings me to another driver, and this is about the quality of these drugs, and especially let's talk about the Kenyan space. You know, we do not know about the other side of the divide, but looking at the Kenyan space, and maybe you can even help us better understand. We always hear people talking about nipe original, staki generic, nipe generic, nataka original, and this is in line with the quality of these drugs that we are being given. When it comes to the quality within the Kenyan space of these antimicrobials, how are we doing? Is it one of the drivers to this antimicrobial resistance that we are seeing, or how are the numbers looking, the patterns therein?
All right, so we were actually having a discussion in the morning with Karen concerning the same. And there's a lot of misconception around the issue of quality, because as you mentioned, brand names, I want the original. And remember, when a company is the originator of a particular drug,
yes,
they are given a patent for a particular time to sell that particular drug. And when that patent is over, other companies are allowed to manufacture the same molecule. So they may package it differently, they may have a different name, a different trade name, but the molecule, so long as that company has followed the good manufacturing practices,
yes,
we expect that that particular drug is of quality and patients should benefit from it. And so you will find differences in price. Remember, this originator company will have to meet back its cost, the cost that it used for research and all that. So they have to meet that cost. So the drug will be more costly as opposed to the generic drugs. But that does not say that the product is not of quality. So we actually again depend on PPB to have all the molecules registered. So my assumption is that the drugs that I'm getting from my wholesaler, yes, are drugs that are registered at PPB, and therefore I can sell them comfortably. So now, not unless we are having now the black market, which I would say consists of a very small percentage. So I shouldn't worry the public so much with the poor quality. Okay. Though definitely I cannot say it's not there. Yeah.
All right. Now, we're going to take a very quick breath at this particular point. I'll be coming back to you, Karen, to just understand what the numbers are saying when it comes to the quality of drugs within the Kenyan space. Remember, this is meant to be an informative session, so if you're using drugs and you feel attacked in one way or the other, fear not. You will be empowered by the time we're done with this conversation. But keep talking to us. The hashtag still remains to be Good Morning Kenya. See you after this break. All right. Mumenifata nikiongea behind the scenes. Karibu sana. Good Morning Kenya is still the program. This is our health segment. This is all about the Antimicrobial Awareness Week, which is coming up between the 18th and the 24th of this month. We'll be giving you more details about that in a bit. But right here in studio, we have two brilliant ladies with us, just telling us more about what antimicrobials are, what we need to know as the common people when it comes to how we manage and use this particular category of drugs to help ourselves be our first lines of defense. With me to my extreme left, we have Karen Bett, who is the policy manager working with Global Partnership for Sustainable Development Data. And to my immediate right, we have Dr. Cynthia Nduta Muregi, who is a clinical pharmacist with a specialty in pediatrics, working at the Kiambu Level 5 Hospital. Now, before the break, we were talking about the quality of drugs within the country, and this is antimicrobials. That's the category that we are referring to. From the data that you were able to gather, is it something that was one of the main drivers as to why we are seeing this resistance coming up among the population?
It did come up in our study, Jain. So, and this is what we were discussing with Dr. Cynthia earlier, that what we had from people is the quality of drugs. So fake drugs is what is causing antimicrobial resistance. And it took us back a bit. We're wondering, Is it true? Is it a perception?
Yeah.
And I think what people suspect is causing, resistance is actual resistance, because you bought a medication, you did not use it well, it's not effective, so you call it fake. So it could be that the drug is not fake, but because you've been abusing it, you've been misusing it, it's not effective, or it's not treating the symptoms like it used to do before. And I think I've heard it so many times. People say, nowadays when I take amoxicillin, it doesn't help me. But I think, from medical terms, that's starting to get into the areas of resistance because the drugs are no longer effective. So for us, we got that that finding of fake drugs, but we're really questioning, is it really fake, or is it a perception, or is it really an indication of resistance?
All right.
Yeah.
So how then do we bring in awareness both among the population and the practitioners and distributors of these drugs to understand, and let's just start with the professionals. From where you sit, I believe you're best positioned to talk about this when it comes to knowing genuine drugs and the fakes within the market. How do we create awareness among the professionals from the medical standing to know that this is fake and this is original, this is going to be effective, this is just a waste of money, and not to consequently dispense it out?
All right. So I would say, first of all, from the retailers and the wholesalers, if you find a product that doesn't look like what you normally sell, I think you should shout out and report the product to PPB, so that it doesn't get to the retailers and therefore to the consumers. So that is just to close that gap where we're having someone maybe use a wrong entry to allow the drugs to pass through. So people should report, and even if it gets to us, the retailers or the people actually dispensing these drugs, we should be able to report and not to dispense anything that we feel is not genuine.
Okay.
Yeah.
Is there a way that I, as a common Mwananchi, can know a genuine drug from a fake drug?
It would be so challenging, because a person trying to come up with a fake product will do it so well. You will not also tell. We have even
can
people,
even doubt the genuine one.
Exactly. We have even people who have tried to imitate the original brand drugs.
Yes.
So how would you really tell? That's why we have to depend on our Pharmacy and Poisons Board. We have to trust that they are doing a good job in terms of regulating the drugs, regulating the practice. Otherwise, it would be so difficult to tell which is genuine and which is fake. Because if you use price, people sometimes have used price and say this one is too cheap. But again, as I was telling us, the originator company needs to make the money that they use
with the production cost,
with the production and everything and the research. So they cannot sell the product the same way as the original company. So again, now the resources also that the manufacturing company has, they may not come up with a good packaging box like the other one. So you might see the box and say, is this really genuine? But that's not the case. So long as they have followed again the good manufacturing practices, then we should trust that the drugs that we are getting are it would be so hazy trying to say, is this genuine? You'd be so confused. You'll get sicker wondering now, did I take the right one? Did I? You
can't go looking at trademarks on every bottle or just trying to examine every tablet. Now let me come back to you, Karen, as we move on from this aspect of drivers, and maybe one last aspect is in regards to now the general population when it comes to the adherence and patients when it comes to using these drugs. To what extent did it contribute as a factor that drives that brings about resistance?
It did. So what we also found is that patients don't have time to queue in a health facility. So, the waiting time at a health facility diverts them to a chemist so that it saves time. How much it costs. You go to a hospital, it costs money. You wait for a prescription, it costs money and time. So you're rather, it's easier to just walk to a chemist and get that medication. And I think the fact that it's so easy to get an antibiotic without a prescription, that also drives people because they know they will get it. You don't need to see the doctor. You will get it. you know your symptoms, you don't need to be, you don't need a laboratory test, because that also costs money. So really, people are money, they're cost conscious in their decisions, and I think that's also a major driver.
Ooh. Purchasing power becomes a very big problem for most.
Yeah.
Now, as we move on, let's talk a bit about the sanitation. You had touched on it a bit, but I'd like for you to just be more clear when it comes to the sanitation and hygiene and storage of these particular drugs, because I can tell you for a fact, I have dropped a tablet and picked it up, unaipanguza na unakunywa tena. Basic things like those that we do that may in one way or the other compromise the effectiveness or efficacy of these drugs that we're trying to take.
All right, I think I would also increase that scope of sanitation and hygiene to actually infection prevention, what we call infection prevention. Because if you prevent yourself from getting that infection, then you wouldn't probably even need that drug at all. So they're just basic hygiene practices, and COVID has really helped us. We saw a drastic decline in the diarrheal illnesses among children when people started washing hands.
Yes.
And so just basic hygiene practices of washing and properly washing your foods as you prepare them, preparing food properly, and also even in our facilities where we actually prevent ourselves from spreading infection from one patient to another.
Yes.
So those hygiene practices, they're very helpful in preventing the spread of these infections. But again, when it comes to now the products themselves, how are we keeping them? How are we taking them? Because if you are storing them in places that are compromised, if you are storing, for example, children's syrups in places where they can actually start getting contaminated, then again you find that already you have compromised the quality of that product. Yeah, and again also for the when it comes to now the issues with I'm trying to look for the
Use Swahili if need be, or mother tongue and translate.
Yeah, so when it comes to also drug storage issues, we have temperatures labels actually on the drugs. If you look at your labels, if your drug, it will tell you store in room temperature, store in the refrigerator, store wherever. So again, if you don't store properly, that product can actually be contaminated because it's not stored the way it's supposed to be.
Okay.
Yeah.
Now, as we bring this conversation to a close, my director is telling me I have 5 minutes or less. Let me come to you, Karen, and this is in line with now the Awareness Week, the World Antimicrobial Awareness Week. It's coming up towards the end of this week and for the better part of next week, and the theme being spread awareness and stop resistance. What do we need to know about this week?
I think so. The AMR week was really a week that was dedicated to, efforts across the world on AMR. So it's bringing together the tripartite, so Ministry of Health, Ministry of Agriculture, Ministry of Environment, because AMR cuts across.
Yes.
And also, to just bring all stakeholders to really rally ourselves on the importance of raising awareness on antimicrobial resistance. I think for this week also, what is coming out, and this came out also in our findings, is AMR is not only an issue that sits with our healthcare workers. It's also something that citizens need to play an active role, because the actions, and as I started, the actions or our inactions is what drives antimicrobial resistance.
Yes.
The way we use drugs, the way we misuse drugs, and just our health-seeking practices is really what is driving antimicrobial resistance. So the week has a number of activities. Most of them is gearing towards, engaging with members of the public to understand what is AMR and what can I do as a citizen towards tackling AMR.
All right. And also just maybe let me get from you, Dr. Cynthia, even in line with your closing remarks, as we mark this week all about creating more awareness to enable us stop resistance. Consequently, what would you like our viewers to take away from this week, even if it's just that one thing in line with AMR?
All right. I think I'd like to just say again, be aware that we are having antimicrobial resistance as a big challenge, and this may not have affected you or may not affect you, but you will have children and grandchildren who will actually now be susceptible to these infections just because we did not take care of them. So this one issues that we are talking about of how are we taking our drugs, how are we seeking our antibiotics, how are we taking them, how are we discarding them, how are we storing them. All those small issues, when we sum them up together, then we can be able to, each and every one of us, take a personal responsibility to minimize this threat of antibiotic resistance.
All right.
Yeah.
And as we close, there's a question that has just come in here. This is Aisha. She asks, why are some kids given medicine, antibiotics, that for that matter, based on their weight and not their age?
All right. So that's an interesting question, because when it comes to pediatrics,
which is your specialty?
Yes. we look at the body surface area, which we don't measure for every child, but we measure the weight of this child and see how much body mass are we accepting this drug to. So the best measure for us is the weight. So we take the weight of the child, multiply by the dose, and that's why you'll find two children, one who is 12 kilograms and one who is maybe 8 kilograms, are probably the same age, but this one has a bigger body mass, so they will actually need a higher dose.
Okay.
And also their metabolism and the issues of excretion and metabolism of these drugs is different for when you compare them to the adults, and therefore we base on weight. Most of the prescription for children, we base on weight.
Good stuff. I think that speaking from a mother's standing gives us such confidence, because you could be having two children, moja ameunga, mwingine hajaunga hivyo, but they're given the same medicine, but you have to give this one 5 ml, you have to give this one 10 ml, but that helps settle that. Well, we want to bring this conversation to a close. That is all the time we had today to speak about the Antimicrobial Awareness week that is coming up towards the end of this week through to next week. Once again, we have been speaking with Dr. Cynthia Nduta Muregi, who is a clinical pharmacist with a specialty in pediatrics, working at the Kiambu Level 5 Hospital. Thank you so much for your time.
Thank you, Jain.
Karibu sana. And we have also been speaking with Karen Bett, who is the policy manager working with the Global Partnership for Sustainable Development Data. Thank you so much once again for your time.
Thank you for having us, Jain.
Absolutely. And thank you for being with us through and through. It has been a pleasure having you from 6:30 a.m. up until now. We want to call it a day, but do remember to join us again tomorrow morning. On behalf of the crew, we want to wish you a lovely day. I am Jain Wambui. See you tomorrow.